What if you could offer your patients an effective, non-invasive, and clinically proven solution for treating acne, improving skin texture, and restoring skin balance, all by integrating advanced technologies into one comprehensive protocol? My name is Dr. Amalia Anghel, and in this advanced course, I will guide you through the correct and effective use of the Geneo X device, along with personalized clinical protocols for mild, moderate, and severe acne. You will discover how to integrate Geneo X into the treatment of mild to moderate acne, maintaining skin balance without aggressive procedures. Enroll today and gain the knowledge, skills, and confidence needed to implement advanced clinical protocols. I am Dr. Amalia Anghel. I have been a dermatologist since 2006 and hold a PhD in melanoma with deep expertise in dermoscopy and skin oncology. I founded Skin Med Clinic in 2014 and work as an international trainer and speaker in medical aesthetics. Every year, I care for over 15,000 patients. Active acne is a problem that needs to be addressed. Acne is an inflammatory condition, and oxygen plays a key role in the healing process. Geneo X helps by reducing follicular obstruction, decreasing inflammation, and improving tissue oxygenation. It also supports barrier repair. Geneo X can be integrated into treatments for mild to moderate acne, maintaining skin balance without causing aggression. Mild acne has a multifactorial pathophysiology driven by four main mechanisms: follicular hyperkeratinization, sebaceous gland hyperactivity, Cutibacterium acnes proliferation, and low-grade inflammation. The dominant clinical features are microcomedones and occasional small papules, with a limited risk of scarring. Our clinical protocol integrates sessions of Geneo X Balance or Clarify and chemical peels. 4 sessions of Geneo X Balance or Clarify with comedone extractions and chemical peel, salicylic acid, are recommended. The sessions are performed at the same time with an interval of 1 to 2 weeks between them. At the end of the protocol, acne lesions are expected to be reduced by more than 90%. The patient will, of course, continue their ongoing topical treatment alongside this therapy. The patient's local treatment includes a cleansing gel specifically designed for acne-prone skin and a cream used as a home care product. Oxipod Balance is chosen for its multiple benefits. Its key active ingredients help improve oxygenation and microcirculation, provide keratolytic and seboregulatory effects, and reduce surface debris and excess sebum. Additionally, it offers anti-inflammatory support, making it highly effective for acne-prone skin. Geneo Balance targets oily and acne-prone skin. It helps reduce excess sebum. It supports skin purification. It calms inflammatory processes. Clinically, Oxipod Balance provides cleaner pores, improved skin oxygenation, and better tolerance to lasers and peels, making it ideal for both acne treatment protocols and maintenance phases. Furthermore, apart from the initial treatment protocol, Oxipod Balance will serve as a maintenance treatment for acne patients. They will continue with their home care regimen and undergo Geneo sessions once a month or according to individual indications. In the pretreatment image, the density of fluorescent points is increased. A compact distribution with multiple clustered foci is evident. This pattern suggests sebaceous hyperactivity, intense bacterial colonization, and a higher inflammatory risk. In the post-treatment image, both the number and intensity of fluorescent signals decrease visibly. The points become fewer and more dispersed. This finding indicates reduced sebum secretion and a lower bacterial load. The numerical values confirm a significant reduction in porphyrin content after the intervention, validating the treatment efficacy from a biological perspective rather than a purely aesthetic one. From a clinical standpoint, the decrease in porphyrins correlates with a reduction in comedones and inflammatory lesions, normalization of the hydrolipidic film, a lower risk of acne recurrence, and improvement in overall skin texture. The treatment produced a measurable reduction in sebaceous gland activity and bacterial biomarkers. The skin shifts from a pro-inflammatory profile to a more balanced physiological state, with a reduced potential for active acne development. Baseline sebum levels show the highest average value, recorded at approximately 157.6 units. This value reflects increased sebaceous gland activity, commonly associated with oily skin follicular congestion, and a higher risk of acne development. After 3 weeks of treatment, the average sebum level decreases to approximately 146.7 units. This early reduction indicates a rapid regulatory effect on sebaceous secretion. The decline suggests improved control of lipid production and a partial restoration of skin homeostasis. At 8 weeks, the average value further decreases to approximately 121.6 units. This represents a substantial overall reduction compared to baseline. The cumulative decrease exceeds 20%, demonstrating a clinically relevant improvement in sebaceous balance. The downward trend remains consistent across all time points. The curve shows progressive reduction without rebound or fluctuation. This pattern supports sustained efficacy and treatment stability over time. From a biological perspective, reduced sebum production limits follicular occlusion, decreases substrate availability for Cutibacterium acnes proliferation, and lowers the inflammatory potential of the pilosebaceous unit. These mechanisms directly contribute to improved skin clarity and reduced acne activity. The data confirm that the treatment delivers measurable, reproducible, and statistically significant control of sebaceous function. The intervention produces a shift from a hyperseborrheic state to a more balanced physiological profile, supporting both therapeutic and preventive benefits in acne-prone skin. Oxipod Clarify is chosen for its purifying, mattifying, and rebalancing effects, specifically designed for oily and acne-prone skin. It deeply cleanses the pores, reduces excess oil and shine, and helps calm inflammation. Its key active ingredients include bamboo charcoal, which absorbs impurities and excess sebum, salixin, willow extract, which provides anti-inflammatory and soothing benefits, Cebulus TM, which helps regulate sebum production, and lactic acid, a gentle exfoliant that refines skin texture and supports natural desquamation. Clarify Oxipod ingredients work synergistically with Geneo X exfoliation and oxygenation to remove surface debris and reduce excess oil, allowing for better penetration of active ingredients and improved tolerance to other treatments. Its key benefits include deep pore purification and shine control, reduction of excess sebum and minimized pore appearance, soothing of redness and inflammation, and leaving the skin balanced, clear, and matte. It is best suited for oily skin with visible shine, acne-prone and textured skin, as well as enlarged pores. We will proceed to discuss a combined treatment protocol for patients with moderate to severe acne, along with the results observed in a patient following this treatment approach. Moderate to severe acne represents an intensification of the same core pathogenic mechanisms observed in mild acne. Endocrine, immunologic, and structural factors amplify inflammation, while follicular hyperkeratinization initiates microcomedone formation. The sebaceous glands become hypertrophic and increasingly responsive to androgens, allowing Cutibacterium acnes to proliferate within the lipid-rich follicle. This inflammatory activation leads to the development of papules, nodules, and cysts with a higher risk of scarring. For moderate to severe acne, a clinical protocol integrating multiple treatment modalities was implemented. The protocol included 2 to 4 sessions of Geneo X Balance or Clarify, combined with 2 to 4 sessions of a non-ablative, non-fractional laser. The sessions were performed alternately, with 1 Geneo X session followed by 1 laser session. In our practice, the standard laser used for this protocol is an erbium glass laser with a wavelength of 1540 nanometers. In our clinic, we use a 1540 nanometer non-ablative laser that delivers controlled thermal energy to the mid-dermis. The laser selectively heats the sebaceous glands, reducing sebum production at its source, while the thermal energy also disrupts acne-causing bacteria, decreasing bacterial load and inflammatory triggers. In addition, inflammation is indirectly modulated, and collagen stimulation improves skin texture and supports skin repair. This laser represents a key component of our acne treatment protocols. Active acne is a problem that needs to be addressed. Acne is an inflammatory condition, and oxygen plays a key role in the healing process. Geneo X helps by reducing follicular obstruction, decreasing inflammation, and improving tissue oxygenation. It also supports barrier repair. Geneo X can be integrated into treatments for mild to moderate acne, maintaining skin balance without causing aggression. Maintenance sessions are performed with OxyGeneo, typically once a month. In addition, every patient should have a prescription for local treatment, which may include medical creams such as Epiduo, Adapalene, or Acleaf. Patients are also required to use a SPF cream to prevent pigmentation. For some patients, oral treatment may also be necessary. All local and oral treatments must be prescribed by a dermatologist to ensure safe and effective acne management. See you in the next chapter where we will discuss about acne scars.